Chaplain Stoglin came to us with complaints of shoulder pain. He had been injured in Afghanistan a couple of years ago in a fall. So he was complaining of pain and some weakness in his shoulder with activity that began with the fall.
I fell hard on my right elbow, literally, and it just jerked up, and I didn't realize what had happened. I knew it hurt initially, obviously, and I didn't tell my wife. I went to the medical clinic, they wrote it up in my medical record, and they offered me Motrin. There was no x-ray that was done, there was no MRI offered, so it was quite a bit of time span that had elapsed between the time that I was initially injured, when I realized I really was hurting because I'd been able to compartmentalize pain because I was in Afghanistan and I was in a very high-profile position and I did not want to leave my command.
We evaluated him and did an MRI, and he was found to have a rotator cuff tear. Rotator cuff is 4 muscles that originates on the scapula and then attaches to the ball of the ball and socket of the shoulder. So it helps stabilize and move the shoulder.
The good news is I was in the United States talking to him. The bad news is I had a torn rotator cuff and it needed surgery. And as a result of that, Dr. Hilliard had to operate immediately. That was a surprise to me, but it had to be done. And thanks to his medical knowledge, skill sets, and insightfulness, I was able to successfully go through the surgery. Of course, that requires rehabilitation. I was to be in rehab for 6 months, but I wanted to be a compliant patient, and at the end of 3.5 months, I was deemed releasable from rehab, and then Dr. Hilliard wanted to do a series of follow-ups just to ensure that everything was good.
Rotator cuff injury can come kind of in 2 different categories. One is with a fall like Chaplain Stoglin had, and then it's fairly obvious that your shoulder's hurting, it's not working, and you kind of seek medical help then. Or it can have more of a gradual onset. Generally people will complain of pain, a lot of times night pain or having trouble sleeping, some limitation of motion with some weakness in their shoulder, and a lot of times kind of crepitus or grinding when they're moving their shoulder. So when any of those things show up, I think it's reasonable to have it evaluated. Recovery is really the hard part because it does take a long time for the tendon to heal back to the bone. It's kind of a difficult biological situation for that tendon to heal to bone. So we have to really baby it. Usually 4 to 6 weeks we don't do much of any kind of active shoulder motion, although we start physical therapy pretty much right away. And then along about 6 weeks the therapy steps up, and it's really more like 3 to 4 months before you can start strengthening the shoulder and returning to regular activities.
Thanks to him, I can easily maneuver my shoulder. Again, he has told me it's going to take time, but it's far better than what it was when we first met. I have been very compliant. He has said, do exactly what I say and you will get back to health. He is the top professional, and if you listen to him, he will guide you. And if you pay attention to what he says, you will be healed.